anyone by any means. Getting a little urine test, you can get some strips pretty cheaply. You can get a refractometer to check urine specific gravity pretty cheaply. Those are ones that will have a ton of value, a ton of return for what you invest in it dollar-wise. These are ones where it can be a debate on that end. Blood work, looking for other things going on to rule out things like kidney disease, other things that are occurring, are nice to do. Heck, nice to do on any cat, especially if they're getting older, especially with medical concern you have. Very rarely is it a must for blood work to figure out if there's something going on. My gut check there is usually just, is it a healthy looking cat? Do they have good muscle mass? Is it a cat that's lived inside for 10 years and is just a happy fat cat? Great. It's probably not dealing with something medically going on otherwise. You can always check if you need to. X-rays, the main thing we're looking for X-rays is looking for stones. Is there something obvious that shows up on X-ray in that bladder? You can also get to it by the next thing on there on ultrasound to see if there's something sitting in that bladder. But the two are not perfect comparisons for each other. You get some better nuance from one where you can see stones easier honestly on X-ray. You can see things like tumors, blood clots, things like that a lot easier on ultrasound. And sometimes you need both of them to figure out which you're dealing with. And if you have access to one, that's great. If you have access to two, you're spoiled. We're spoiled on that side of it, definitely. But it's one where having access to one or the other can be nice. X-ray's tough because a big unit is probably $40,000, $50,000 to set up. You can get some little handheld ones you can move around that can be less expensive, but the state of Minnesota doesn't like the ability to point radiation producing equipment at people. So there's a lot more regulation that goes around with it. You can get some actually pretty cool little handheld ultrasound machines. We have those in our smaller sites for $4,000 or $5,000. Not inexpensive by any means. They are still very expensive, but much more easy to get than a big X-ray machine too. And there's not state regulation of ultrasound machines, which is nice on that part of it. Culture, I have culture up there. That's culturing the urine, sending stuff into lab to get culture results. There, I want you to refer back to what I talked about at the beginning on the likelihood of infection. If you're seeing bacteria, if it's the right age group, I'd be more likely to do a culture. Culture is usually a lot of investment in dollar. If you're in private practice, it can cost you $150, $200 at the vets to get a culture on things. The lab is probably going to charge you $80, $90 to get a culture on it, and you're not always going to get a good result. Or you're not going to find something there that you can treat. And then even if it's an older cat and they find something, a little bacteria called Proteus, it usually doesn't even cause problems in the first place, and it confuses you more than it gives you an answer. So cultures are something that can be part of the picture, but aren't the end-all, at least in the shelter decision-making we do. In private practice, it's a very different thing, but in shelter, it is a different way to look at it. And then one of the things I love doing in private practice and in shelter is therapeutic trials. Let's throw some meds at it, let's throw things at it and see what happens. See if things get better, see if things improve. And even there, it's not perfect. If you throw antibiotics at it and it gets better, it doesn't always mean it's an infection. But there are advanced diagnostics you can do beyond just your basics. All right, treatment based on diagnosis. How are we doing time-wise? All right, good, okay, excellent. So, thinking of various treatments that we're dealing with, we're going to spend a while on the slide. I put out kind of the list of things medically that we see, some very common, some not. In veterinary medicine, in animal welfare, you name it, we love our acronyms. So all those freaking acronyms on line 1 are all various ways of talking about stress. Those are the various ways you can refer to stress-induced urinary issues in cats. We already talked earlier about stress causing respiratory disease, causing feline herpes virus and other things to recrudesce and cause respiratory signs. Stress also can be a cause for urinary issues in cats. FIC is feline idiopathic cystitis, feline urinary syndrome, feline lower urinary tract disease complex. I love the term Pandora syndrome for a different way of looking at it. What this is, it's a little bit of stress causing issues, but it's more that who has experienced stress sometimes in the past week? Yeah, stress is out there, stress happens. It is how the cat responds to stress. It is not that life is too stressful for this cat. If there's a ton of stress going on, sure, it would make it more likely for something like this, if this cat's predisposed to have urinary issues associated with stress, to occur. But I've definitely talked to clients about it, and they're starting to get worked up, and they're feeling bad because, oh God, I made my cat's life so stressful, what can I do? I'm like, no, it's not you. We all have stress. It is how you deal with the stress, or in this case, honestly, how the cat's own immune system, how the cat's own physiologic system responds to that stress that causes issues.
What is the D in the lower urinary tract?
Disease.
Oh,
Yeah.
No, I thought it was,
Oh yeah, fluted feline lower urinary tract disease is the, at least how I had it taught to me. I think that's what it was when I graduated. And it's moved and gone back and kind of like angled through the different places. But this here, this one, this is the most common type of middle-aged cat urinary disease you will see. It can be sometimes never noticed. There'll be a few spots of blood in the litter box and it'll pass on its own. It also can be something that you get enough inflammation, enough irritation built up in the bladder that especially a male cat could block, and it can be life-threatening. The clinical signs associated with it can be all over the place, but the disease process is actually really similar on that type of it for the type of disease you're dealing with. It's usually a 7 to 14 day progression of clinical signs, and if you do absolutely nothing, and as long as they don't block up, they're going to get better. So it's something that for years and years and years it was, my cat's peeing blood, I'm going to go to the vet, they're going to sell me a bottle of Clavamox for 20, 30, 40 bucks, I'm going to give it, by the time I'm done with the Clavamox, they're doing great, awesome, I fixed it. And the vet's like, great, I gave them Clavamox, their cat got better, I didn't have to do anything else, great, we fixed it. And then when we actually understood the disease, we realized we were doing nothing. They've done a lot of studies looking at various treatments for this, and unless there's a blockage you need to relieve, they've given things to relax urinary sphincters, it hasn't changed much. They've given things like pain reliever for it, it symptomatically makes them feel better because opioids can make you feel better, but otherwise hasn't changed much for length of time and outcome. There really is not, other than dealing with the secondary signs that can come with it, something that's been shown to treat an acute case of this. We will usually put cats on a urinary diet afterwards. High salt content increases how much urine flows through them, dilutes things out, makes it less likely for this to occur. There are other really smart things that Hill, Science Side, other groups of theory put out there that I don't understand that seems to help on that part of it. But urinary diets do seem to at least decrease the frequency of severe clinical signs associated with idiopathic cystitis, feline urinary syndrome, any of that first group we're dealing with. And you often get, especially in shelter, stress of coming into a shelter where we'll have behavioral issues and this. So there are times where we'll get this tackled, get them on a urinary diet, and then deal with the other issues that come along with it. So thinking of urinary disease, depending on, talked about age earlier, things like that. If it's a middle-aged cat, it actually is usually that top one until proven otherwise. Unfortunately, the only way to diagnose that top one is to rule out everything else. There is not a blood test, there is not a specific urine test or anything that shows you are dealing with idiopathic cystitis. It's the clinical experience that we've looked for everything else, you fit as the right clinical signs with it, and they're going to get better in 7 to 14 days. The typical cat there is either peeing a little bit of blood or just seems uncomfortable and has a really small, firm, kind of like a little racket ball or maybe even a squash ball in this tiny, if you want to play squash. Just a little small, firm bladder when you get in there and feel on it. So looking for the other things. That is where you can go through infection. Infection can be a myriad of things. When you're dealing with a urinary tract infection, that means the whole urinary tract. You can have anything from a pyelonephritis, that is a kidney infection, all the way through a vaginitis. So anywhere in that urinary tract, things can be infected, and the clinical signs you see are going to be associated with wherever that infection is occurring. Your treatment is going to be based on where it's dealing with. External infections, most infections are ascending infections. They start externally. You actually can see it often in kittens. They will literally have pus building up around their urethra somewhere, and that makes you a lot more suspicious that you're dealing with a urinary tract infection. Kidney infections are usually harder to diagnose. You treat them a lot longer, but usually have a much sicker cat. If anyone here themselves has had a pyelonephritis, it's actually pretty darn painful, and you're feeling really sick associated with it. So the higher up that urinary tract you go, from external opening, urethra, bladder, ureters, up into the kidneys, the further up you go, the sicker you are. The longer antibiotics you need to get things fixed. And that is one where usually, but not always, you can see bacteria if you get a urine sample and look around for it. But if you're dealing with a urethral or a vaginal infection and you get a urine sample from a cystocentesis, there's no infection there yet. So you can't always see the full signs. That's why making sure it's an external examination I'm doing as part of it. Uroliths, that's just the fancy veterinary term for stones. Lith being stone. So dealing with stones anywhere in that tract is what we're talking about. And it's something that x-rays are the best way to diagnose on this part of it. If you see stones, my favorite surgeries, this is a picture from, I don't remember where I stole this one, but this is literally what it does look like, cutting open the bladder, pulling out, that's probably a struvite, which is an overabundance of phosphorus made stone. They're nice and smooth and looks like that. But there are also ways to eliminate stones via diet. One really nice advancement that's happened in most of the urinary diets these days, it used to be you have to have a specific calcium oxalate versus struvite diet. They've been really good at making sure it's now for all of them. So if you have a cat with urinary signs and it looks like there's a stone going on, you see on x-ray, you can throw them on a diet for a month. That stone's been there for months and they've been stable, so you can throw them on a diet for a month, re-x-ray and see if it's getting smaller or going away or not. If you have the option to do surgery and get them out of the shelter within a week, then it might be worth doing surgery now. If you have to refer that out or get them to a specialist and pay thousands of dollars for it, if you got a foster home, which will save you so much on the care costs, a diet and time is fine on that side of it. Finally, neoplasia on there is something you always have to keep. Cancer is something you have to keep on your radar. It can happen even in younger cats, and it is something that those unfortunately are usually rarely benign. They're usually nasty ones that you have to make a decision of, if I fix it, that's great, but I'm usually buying months to maybe a year in this situation. And keep it on your radar, even in younger cats, of something that can be there. And then finally on that, I just like to throw the weird ones. Idiopathic, the root word is not the exact same root word as idiot, but it does mean we have no idea what's going on or what caused it. But idiopathic renal hematuria is sometimes you literally have just kidneys that excrete some blood. Sometimes you have to remove a kidney to take care of it, but there are times where you will search and search and search and never really find out what you're dealing with. In those situations, you look at the cat, you make the best decision you can. So from there, I think this has been where are we at time-wise? Good, 2:30. This has been a quick 20 to 25 minute primer on all things medical for the urinary side of things. You will not be tested or required to remember this. I want this to be, this is the medical side of things that we're working up and eliminating as possibilities or making sure we're managing before we jump to the behavior side of things.
All right, thank you, Dr. Graham. So if you go on that medical journey, you don't get a diagnostic, nothing's working, right? That begs the question, why is this cat still going outside the litter box without an underlying medical cause? We think then it is behavioral. So we've talked about stress a lot, and stress in this context, I want you to think about what has changed in that cat's environment. So if we think about our lives, we get to go to work, we come to this conference, we go out to dinner. Our cats live, in the confines of our house, so they get really in tune to what's going on. So there's sometimes really obvious changes that happen. Maybe you add another cat or a dog to your family. Maybe you have a child. Maybe that child starts crawling around and stressing that cat out. Maybe there are community cats outside, like Rose talked about, that are stressing out your indoor cat. Maybe it's spring and they're making sure we have a lot of kittens for kitten season. So think about those obvious changes, and then think about even more subtle ones. So did your schedule change? Are you doing something different? Did you change furniture? Did you rearrange furniture? That stresses my cats out a lot. If I deep clean the house and move the furniture around, they get really stressed out by that. Did you change those cleaning products in your home? Is some sort of construction happening either in your home or outside your home? I know in the summer, we love road construction here in Minnesota. So think about those things. Sometimes they're really obvious, sometimes they're more subtle, but they really are possibilities are endless for something that might have changed in your cat's environment. Also think about your cat as an individual. So just like us, all cats are individuals and they'll have individual preferences. So think about the litter type that you're using. Think about the type of box that you're using. Is it a covered box? Is it uncovered? Does it have a door? Did you recently put up a baby gate that's maybe making the access a little bit harder for your cat? Maybe the cat got a little bit older and doesn't want to jump over anymore. So think about your cat as an individual. If you have multi-cats, think about them all as individuals, as they likely all have different preferences. Think about the cleanliness. So, I know we all probably want to hold ourselves to a really high standard, but really make sure you're doing your due diligence on that cleanliness. And then when you have multiple cat households, make sure you have the appropriate number of litter boxes per cat, and make sure they're actually in different areas too, because if you have a whole bunch of litter boxes in one area, they can think of that as one, so spread those out. And yes, the question?
So what is your recommendation for boxes per cat?
Yes, so our recommendation for boxes per cat is 1 box per cat plus 1. If you have a lot of cats in your home, that might not be feasible, so have as many as you possibly can. And I think the biggest thing there is make sure they're in a couple different areas of your house. You have all those litter boxes just in one spot, especially if there's a narrow entryway for the cats to go in and out of that, they can start to view that kind of as one collective unit instead of the individual boxes that they are. So get more boxes, spread them out, have 1 per cat plus an extra. So, and think about, right, again, where they're located, how easily accessible it is to all your cats, and any changes. So how you can help reset in the home. So I want to reiterate again that we want to make sure there's no underlying medical cause for those litter box issues. So take them to the vet, run those diagnostics, make sure there's nothing going on there medical, so you're pretty confident it is behavioral. So once you're there, try different types of litters, try different types. So a lot of litters come in smaller bags, grab one of those. All of you guys, I think, raise your hand that you have cats in your home, so talk to your friends, talk to your coworkers, ask if you can have a little baggie of sample litter from what everybody else is using. Maybe that's a little bit more cost effective. And then start to try to give your cat some options and see what they like. Give them different types of litter boxes. Make sure they are easily accessible, so they have lower lips so the cat can get in and out. Make sure there's not a door on some of them.